This is chapter 6. This is going to be on shock. So in order to understand shock, let's go back a little bit and review. There needs to be enough red blood cells and water in the blood for the heart to push all the fluids around within the blood vessels. So when the body is dehydrated, there may not be enough red blood cells, and the total volume of fluid is decreased and pressure within the system decreases. Water makes up 90% of the blood. If the water is lost or fluid intake is inadequate, such as in dehydration, the body tries to maintain cardiac output by making the heart beat faster. So it tries to compensate. But as the blood fluid losses mount up, the body's compensation mechanisms fail, and that's when you may have shock. So it's a condition produced when the cardiovascular pulmonary system fails to deliver enough oxygenated blood to the body tissues to support all of its metabolic needs. And the cardiovascular is heart and blood vessels, and pulmonary is our lungs. So the heart and the lung system is what fails to deliver enough oxygenated blood to the body tissues. So due to the oxygen depletion, the body tissues use anaerobic metabolic processes, and which in turn produce acidosis and harmful toxins. This causes additional harm to the tissues. So there's 4 stages of shock. All 4 stages, categories of shock, all of the 4 of them go through these same 4 preliminary stages. They have an initial stage, they have a compensatory stage, a progressive stage, and a refractory stage. In all forms of shock, what you're going to do with treatment is always contact EMS first. All forms of shock will show a reduction in blood pressure. These are important to know that are especially in red. Let's go through the initial stage. That's the very first one. That's when the cells are deprived of oxygen. So it inhibits the ability to produce energy, and the cells can't function properly. Impacts all the body systems. Compensatory, that's where the body performs physiological adaptations in an attempt to overcome the shock or compensate for the fact that it's not getting enough oxygen. It tries to get the oxygen from other sources. So increased respiration helps to increase oxygen to the cells. So your respiration is going to speed up. Increased blood pressure, it's going to cause an increase in blood pressure at first to compensate for all of the hypotension until it can't anymore, and then it will go into hypotension or low blood pressure. It reduces the blood supply to the peripheral organs to improve blood supply to the brain. So you're going to get in your arms and legs are going to get less, your kidneys are going to have less blood supply so that your body will send it all to the brain so that you can try to stay alive. Reduce the blood flow to the kidneys, with resulting in oliguria, which means reduced urine output. So it won't have an urge to go to the bathroom. Then you go into the progressive. That's when your body's attempts to compensate for this have failed. It's not enough. So if the problem causing the shock is not treated, then the condition worsens into the progressive. So your vital organs now are compromised and they're not functioning appropriately. So plus you have systolic hypotension, and the systolic pressure goes very, very low. Refractory stage, failure of the vital organs. They don't have enough oxygen. You're going to have failure eventually. It's irreversible when it gets to this stage. There's nothing you can do about it. You can have cell death and brain damage have occurred, and death will even occur within a few hours. So these are the 4 types of shock that will each go into all 4 of those different stages. First, you have hypovolemic shock. This is where you either hemorrhage, maybe you've been stabbed or shot or something, and you are hemorrhaging blood. And there's such a loss of blood that there's no way to really stop it. It's severe or severe dehydration. Hypo means less than, volume is vol, and emic has anything to do with the blood. So this is less than normal blood volume, and that's what can go into shock. Now that will go through an initial stage, a compensatory stage, progressive stage, and then it will go into the last stage. Now we have distributive. This is vasodilation and distribution of blood is abnormal. So this could be anaphylactic. You have an anaphylactic shock or anaphylactic something happen and your circulatory system collapses. You could have septic shock. Septic, you've all heard of, it's bacteria in the blood. You get a really high fever, edema, which is swelling, and you absolutely need antibiotics, which is the capital ATB. So septic shock, very often you'll hear of that in the hospital. People go into the hospital and may get bacteria in the blood, and they will go into septic shock there. You have neurogenic. Genic at the end of any word means genesis. It's kind of like where it begins. And neuro means nerve. So it begins in the nerves. You have a loss of sympathetic nerve activity. It causes peripheral dilation and a decreased venous return. So when your peripheral blood vessels begin to dilate, it always results in a lower venous return to the heart or lower blood pressure. Then you have obstructive. Obstructive is indirect heart pump failure, pulmonary embolism. That's when you have a blood clot, an embolism, a piece of a blood clot has landed in the lungs. You have a narrowing of the arteries, cardiac tamponade, and that means you have a compression on the heart, and that's due to the blood accumulation around the heart. All of these result in very cool skin. Your patient will have very cool skin, except for septic shock. And septic shock is always coupled with a very high fever. The treatment for all forms of shock is that you're going to remove the instruments from the mouth and contact EMS. So on your tests, I would say if all they have is remove instruments of the mouth and then some other obscure answers, the answer would be remove instruments from the mouth. Sometimes they'll give you multiple choice where they won't say remove instruments from the mouth, but they'll just say contact EMS or do 3 other things. And then the answer would be contact EMS. But in all forms of shock, naturally you're going to be removing instruments from the mouth, but you definitely yell for somebody to contact EMS. The position of the patient should be laying down. It should be supine. You don't want someone in shock to be sitting up. You want to be able to support equal blood flow to the brain and the heart. So you do your CABs of CPR, monitor the vital signs about every 5 minutes. You might need to administer oxygen. If so, it's your normal 4 to 6 liters per minute. This patient really needs fluids. This patient needs IV fluids, something that you cannot give them. So the EMS would set up some fluids or rush this person to the hospital and get them on an IV. So they need surgical treatment for if it's obstructive. It's a clot or something. They need antibiotics and surgery for septic, and they need that immediately when there's bacteria in the blood. They may need an EpiPen and histamine blockers if it's from an anaphylactic source. Cardiac medications, if it's cardiogenic, it begins in the heart. Shock, and what you want to do is arrest all of the hemorrhaging or dehydration. You want to stop all of that if it's hypovolemic.